Thank you, Sachin. And he no longer works for me, and he still said those things. I want to thank also the American Journal of Managed Care for for being willing to do this this journal edition. I think we at the Office of the National Coordinator can sometimes lapse into the illusion that everyone thinks about health information technology 24/7. Of course, that's not true. And having a journal commit itself at this extent to this particular topic, in my view, shows a great deal of wisdom, but also shows some courage and I think some insight into the future of this technology. There are many folks who contributed to this journal. I think it's one of the most impressive things about it is the breadth of the contributors and the bipartisanship of the contributors. To have a journal journal edition in which both Congressman Stark and former Speaker Newt Gingrich write and write favorably shows that there's something about this work that has an intuitive and compelling appeal for a broad spectrum of the American public. That's not to say that our work is easy. There are many, many hills still to climb. Every time we get to the top of one, we see 5 more emerge ahead of us. And that is absolutely where we are in the evolution of the work of the Office of the National Coordinator. We work closely with the Center for Medicare and Medicaid Services, where Sachin is now our expert in residence. He's moved over to be senior advisor to Don Berwick, and that's to everyone's benefit. I've been assisted in our work enormously by a number of the folks on this panel. Melinda Bukes-Button, who runs our Office of Economic Modeling and Analysis, and Aaron McKeithen, who runs our Beacon Community Program, and they are both stellar leaders of the critical work of our office. The health information technology is not about health information technology. This is something that we try to talk about every day. It's not about the programs we run. It's not about the technologies we try to take advantage of. It is about the daily work of patient care, making our health system better, making it higher quality and more efficient, being sensitive to the needs of our clients who are physicians and nurses and other health professionals and small and large healthcare institutions throughout the United States, empowering them to be better at what they do, and to do that in a way that is supportive of and consistent with their professional missions and their professional norms. That's really the mission of our office, and it is, in a sense, completely indistinguishable from health reform writ large. It is the underpinning of health reform in the sense that health reform, health improvement, whether it's at the level of an individual patient-physician encounter, whether it's the level of a managed care organization like a Kaiser or an integrated delivery system, whether it's the level of a state or a region, whatever the task, it is based upon and dependent upon information that informs decisions. The decision about a medication or a test order, the decision about the allocation of resources in an organization, the decision about goal setting and goal monitoring, decision about legislating for improved health system organization. All of that is about information. And in the 21st century, the source of information should be, has to be, will be electronic health systems, electronic health information systems that will give health professionals feedback about their performance in real time, that will give organizations feedback about their performance in real time, that will give patients information about their providers and their own health, at their beck and call, and that will give those of us who function in Washington far better information about how our systems are functioning, our programs are doing than we have ever had before. So I think that it's fully appropriate that a Journal of Managed Care should devote itself to this topic. As a physician by training, I have always used the term management with respect to patient care. It was instinctive for us, as talking with colleagues, to talk about how to manage a patient or how to manage an illness or to manage a problem. So despite the experience of the 1990s, I have never found managed care to be a off-putting term. It is a core to what we do. And I think that information technology will be a wellspring of improvement for the management of care for the next century. Thank you very much, and I look forward to the rest of the presentations.